Hello, I am Dr. Khalilah Jefferson, DNP. Today, I would like to discuss blue collar, white collar, or something else. Rethinking the identity of nursing. I want to start with a question that comes up more often than people expect. Is nursing a blue collar profession or a white collar profession? At first glance, the answer seems obvious. Nurses are highly educated. They make complex clinical decisions. They work in one of the most advanced scientific fields in the world. That sounds very white collar. But if you spend even one shift on a hospital floor, you'll see another reality. Nurses live patients. They run between rooms for 12-hour shifts. They handle bodily fluids, emergencies, and physical exhaustion. That sounds very blue collar. So, which is it? To answer that question, we have to understand what those terms really mean. Historically, blue collar work referred to jobs involving physical labor manufacturing, construction, trades, work done with your hands. White collar work referred to professions involving education, decision making, administration, and specialized knowledge. Work done primarily with your mind. But nursing has always lived at the intersection of both. A nurse might spend one moment interpreting lab results, adjusting medications, and recognizing subtle clinical changes that prevent a crisis. And the next moment, they're helping a patient stand, cleaning wounds, or responding to a code. Nursing requires both intellectual expertise and physical work. In other words, nursing doesn't fit neatly into the categories we created. And that brings us to another question people often ask. Does becoming an advanced practice nurse, a nurse practitioner, CRNA, or a clinical nurse specialist shift nursing into the white collar category? Advanced practice nurses certainly expand the cognitive side of nursing. They diagnose illness, prescribe medications, perform procedures, lead clinical decision making. In many ways, their responsibilities resemble those traditionally associated with other white collar healthcare roles. But here's the interesting thing: even in advanced practice, the core of nursing doesn't disappear. The bedside thinking, the patient centered perspective, the willingness to step into the hands on moments of care, those roots remain. So perhaps the real problem is not where nursing falls on the blue collar or white collar spectrum. Maybe the problem is the spectrum itself, because nursing represents something unique. It is a profession that combines science and service, critical thinking and compassion, technical expertise and human connection. Few professions require all of those at the same time. So instead of asking whether nursing is blue collar or white collar, maybe we should ask a better question: what kind of profession requires both the mind of a clinician and the hands of a caregiver? The answer is nursing. And whether someone is a bedside nurse or an advanced practice provider, the profession continues to evolve, not by leaving its roots behind, but by expanding what those roots can support. Because nursing has never been defined by the color of its collar. It is defined by the complexity of its work and the impact it has on the lives of the people it serves. Thank you.